Something changes in the relationship between a person and their body somewhere around the age of 60, not just the physical changes that everyone expects and that the culture prepares you for in its blunt and sometimes unkind way, the slower recovery times and the joints that carry more history than they used to, and the reading glasses that appear on every surface of the house. Something more subtle changes too, something in the nature of the conversation that your body is trying to have with you. The signals it sends become more important, more loaded with information that matters, more urgently in need of being heard rather than dismissed or explained away or attributed to the general passage of time. Because after 60, the body's warning system is operating in a different context than it was at 30 or 40, a context in which certain symptoms that might have been genuinely minor at an earlier age carry a different weight and a different set of possible meanings, and in which the window between noticing something and doing something about it can be narrower than most people realize. The problem is not that older adults do not notice things. Most people are quite attentive to their own bodies, particularly after 60, when health naturally becomes a more conscious concern than it was in the years of taking physical function largely for granted. The problem is more specific than that. It is that people have developed, over decades of living in their bodies, a set of interpretive habits about what different sensations and symptoms mean, and those habits were formed in a context that no longer fully applies. The fatigue that at 40 meant you needed a good night's sleep might at 65 be carrying a different message. The breathlessness that at 35 was simply the normal consequence of having pushed a little harder than usual might at 70 be the body's way of flagging something that deserves medical attention. The distinction between the normal and the significant, between the symptom that can be watched and managed at home and the symptom that needs professional evaluation without delay, is one that can genuinely be life-saving to understand correctly, and it is one that far too many people navigate with less information than they need. What follows is a serious and honest conversation about the warning signs that adults over 60 should never ignore. Not presented in the spirit of alarm or of catastrophizing the normal experiences of aging, but in the spirit of genuine respect for the people reading this and for their right to understand their own bodies clearly. The research on late diagnosed conditions in older adults is consistent and sobering in one particular finding, which is that the delay between the first appearance of a warning sign and the moment a person seeks medical attention is one of the most significant factors in determining the outcome of some of the most serious conditions that become more common after 60. Time matters. Understanding which signs are telling you that time matters is not about living in fear. It is about living with clarity. The first warning sign that deserves serious and immediate attention is chest pain or discomfort of any kind that is new or unusual, and this encompasses a broader range of sensations than most people realize. The popular image of a heart attack involves dramatic, crushing chest pain that announces itself unmistakably, and while that presentation does occur, it is far from the only way that cardiac events present themselves, particularly in older adults and particularly in women. The research on how heart attacks present in people over 60 reveals a picture that is more varied and more subtle than the cultural image suggests. Pressure, tightness, squeezing, heaviness, aching, or even a sensation that is more discomfort than pain can all be the heart's way of signaling that something is wrong. The discomfort may be located not in the center of the chest but in the jaw, the neck, the left arm, the upper back, or the shoulder. It may come and go rather than persisting. It may be mild enough to rationalize away, to attribute to indigestion or to muscle tension, or to the general bodily background noise that most people over 60 have learned to live with. The reason this warning sign is so critical to understand is precisely because of this variability and because of how people typically respond to it. Studies looking at why people delay seeking care when they are having cardiac events consistently find that people spend time, sometimes hours, trying to determine whether what they are feeling is serious enough to warrant the disruption and the potential embarrassment of seeking help. They take antacids. They wait to see if it passes. They do not want to be the person who went to the emergency room for indigestion. This delay has real and measurable consequences. The heart muscle that is being deprived of blood during a cardiac event begins to die within minutes, and the amount of damage that occurs is directly related to how long the event lasts before treatment is received. The treatments available for cardiac events are most effective when they are deployed quickly, and the window during which they can make the most significant difference is measured in hours. Any new chest discomfort that persists for more than a few minutes, that occurs along with other symptoms like shortness of breath or sweating or nausea, or that simply feels wrong in a way that is different from normal physical sensations, deserves immediate medical evaluation. Not tomorrow. Not after seeing if it goes away on its own. Now. The second warning sign is sudden or unexplained shortness of breath, and it deserves the same urgency and the same refusal to rationalize away that chest discomfort does. Breathlessness that comes on suddenly, that occurs at rest or with minimal exertion that would not previously have caused it, or that wakes a person from sleep, is the body communicating something important about what is happening in the cardiovascular or respiratory system, and the range of serious conditions it can signal is significant. Heart failure, in which the heart is not pumping effectively enough to meet the body's demands, frequently presents with shortness of breath, particularly when lying flat or with modest exertion. Pulmonary embolism, a blood clot that has traveled to the lungs, can present with sudden breathlessness that may be accompanied by chest pain or a cough. Pneumonia in older adults can sometimes present with breathlessness as a primary symptom, even without the dramatic fever and cough that the condition is classically associated with. The specific danger of unexplained breathlessness in older adults is compounded by a tendency that researchers have documented across multiple studies, which is that older adults often unconsciously adapt to gradually worsening breathlessness by reducing their activity level so that the symptom is experienced less intensely because the demands placed on the cardiovascular and respiratory system have been quietly scaled back. This adaptation can mask significant underlying disease progression, allowing conditions to advance to a more serious stage before they generate symptoms that are impossible to explain away. Paying attention to any change in how much exertion it takes to produce breathlessness, any situation in which activities that previously felt comfortable now feel winded, is an important form of self-monitoring that can catch serious conditions at earlier and more treatable stages. The third warning sign sits in a category that generates more confusion and more delayed response than almost any other, precisely because it overlaps so significantly with the normal experiences of aging. It is persistent or unexplained fatigue, the kind that does not resolve with adequate sleep, that is not clearly explained by recent activity or illness, and that represents a meaningful change from a person's normal baseline energy level. The reason this warning sign generates confusion is that fatigue is so common and so multifactorial that distinguishing between fatigue that is simply the normal experience of an aging body living a full life and fatigue that is the body's signal of something more serious requires both honest self-assessment and often medical evaluation. The conditions that can present with unexplained fatigue in adults over 60 include some that are serious and some that are highly treatable once identified. Anemia, which becomes more common with age for a variety of reasons, including changes in nutrition, chronic disease, and in some cases gastrointestinal blood loss that has not been detected, is one of the most common and most correctable causes of significant fatigue in older adults. Hypothyroidism, an underactive thyroid gland, is extremely common in older adults and particularly in older women, and its symptoms include fatigue, cognitive slowing, weight gain, cold sensitivity, and depression in combinations that are often attributed to aging itself rather than to a treatable medical condition. Heart disease can present with fatigue before it presents with more obviously cardiac symptoms. Diabetes, both diagnosed and undiagnosed, can cause fatigue. And certain cancers, particularly in their earlier stages when treatment is most effective, may have fatigue as their most prominent early symptom. The key distinction that makes unexplained fatigue A warning sign, rather than just a feature of the normal aging experience, is the combination of persistence and change from baseline. Everyone is tired sometimes. The fatigue that deserves medical attention is the fatigue that does not go away with rest, that has been present for weeks rather than days, and that represents a meaningful departure from how the person normally feels, rather than simply the existence of tiredness. If you are someone who has generally had adequate energy for your daily activities, and you notice that this has changed in a way that is persisting over time, that change deserves to be evaluated rather than accepted as inevitable. The fourth warning sign involves changes in cognition, and specifically changes that are sudden or that represent a meaningful departure from established baseline function. The distinction between the normal cognitive changes of aging and the early signs of conditions that require medical attention is one that people navigate with considerable anxiety and considerable uncertainty, and understanding it clearly can both relieve unnecessary worry and prompt appropriately timed medical consultation. Normal aging does affect cognition in specific ways. Processing speed slows. The retrieval of names and words that are well known takes slightly longer. The ability to hold multiple pieces of information in working memory simultaneously is somewhat reduced. These changes are real, and they are the normal neurological consequences of aging, and they do not indicate disease. What indicates disease, and specifically what can indicate conditions including but not limited to Alzheimer's disease and other dementias, is cognitive change that goes beyond these normal adjustments in specific ways, getting lost in familiar places, forgetting not just where you put your keys, but what keys are for. Losing track of conversations in ways that involve not just forgetting the earlier parts, but being unable to follow the thread at all. Repeating the same story or the same question within a single conversation without any awareness of having just said it. Difficulty with tasks of daily living that have been performed automatically for decades. These are not the normal cognitive changes of aging. They are warning signs of possible pathological processes that deserve evaluation. Perhaps even more urgently, any sudden change in cognitive function, not a gradual subtle shift over months, but an abrupt change in mental clarity or behavior or personality, deserves emergency medical attention. Sudden confusion, sudden difficulty finding words that were easily accessible moments ago, sudden changes in behavior or personality can be signs of a stroke, of a transient ischemic attack, of a dangerous medication interaction, of an infection affecting the brain, or of other conditions that are medical emergencies. The window for effective treatment of strokes in particular is measured in hours, and the acronym that emergency medicine uses to help people recognize stroke symptoms, FAST, standing for face drooping, arm weakness, speech difficulty, and time to call emergency services, is worth knowing and worth keeping immediately accessible in memory. The fifth warning sign is one that people over 60 frequently dismiss or explain away with particular confidence, and that is the occurrence of falls or near falls or new problems with balance and coordination. Falls are the leading cause of injury-related death in adults over 65 in most developed countries, and the injuries they cause, particularly hip fractures, have consequences that extend far beyond the immediate physical damage in terms of their effects on independence, on subsequent health trajectories, and on mortality. This makes falls a serious medical concern in themselves. But beyond the direct danger of falls, the occurrence of falls or significant balance problems is also an important warning sign for underlying conditions that may be contributing to them and that need to be identified and addressed. The conditions that can manifest as increased fall risk or new balance problems in older adults include some that are highly treatable and some that require ongoing management. Inner ear problems that affect the vestibular system can cause significant balance disruption. Medication side effects, particularly from combinations of medications that individually might not cause significant problems, but that interact to affect blood pressure or balance or alertness in ways that increase fall risk, are an extremely common and extremely under-recognized cause of falls in older adults. Low blood pressure that occurs when standing up from a sitting or lying position, a condition called orthostatic hypotension, can cause dizziness and falls and is both diagnosable and manageable. Neurological conditions, including Parkinson's disease and its variants, can present with balance problems as an early feature before the more classically recognized symptoms have become obvious. A first fall that is not clearly explained by an obvious external cause, a fall that occurs because you tripped over something obvious in good lighting and good conditions, deserves medical evaluation to determine whether there is a contributing underlying cause. Multiple falls are an urgent medical concern regardless of each individual fall's immediate explanation. And new problems with balance or coordination that occur without an obvious explanation deserve prompt medical attention even in the absence of an actual fall. The sixth warning sign is one that occurs below the level of obvious symptoms in a way that makes it easy to miss entirely without deliberate attention, and it is unexplained weight loss. Losing weight without trying, without a change in diet or activity level that would explain the change, is one of the body's more important signals that something significant may be happening internally, and in adults over 60, it deserves investigation rather than congratulation or casual acceptance. The conditions that can cause unexplained weight loss in older adults span a significant range of seriousness and include some of the most important to catch early. Many cancers cause weight loss as an early feature, before other, more specific symptoms have appeared, and the involuntary weight loss that can precede a cancer diagnosis sometimes predates other symptoms by months. Hyperthyroidism, an overactive thyroid, causes weight loss along with other symptoms including rapid heartbeat, anxiety, heat intolerance, and tremor. Depression in older adults can present with appetite loss and consequent weight loss as prominent features, sometimes without the sad mood that people associate with depression as a primary marker. Diabetes can cause weight loss in some circumstances, and certain medications can suppress appetite in ways that lead to clinically significant weight loss over time. The threshold that medical guidelines generally use for unexplained weight loss as a clinically significant finding is approximately 5% of body weight over 6 to 12 months without intentional caloric restriction or increased exercise. For a person weighing 160 pounds, that is approximately 8 pounds. This is not a dramatic amount of weight loss, which is partly why it gets explained away so often, particularly in a culture that tends to respond to weight loss with approval rather than concern. But in the context of older adults and in the absence of a clear lifestyle explanation, it is a finding that deserves medical evaluation. The seventh warning sign involves changes in bowel or bladder function, a topic that generates considerable reluctance to discuss in most people and considerable embarrassment when it does come up. But that is too important to health in this age group to be omitted from any serious conversation about warning signs after 60. The specific changes that deserve attention are those that represent meaningful departures from established patterns and that persist over time without an obvious explanation. Blood in the stool, whether visible on toilet paper or in the toilet bowl or detected through the kind of screening tests that are part of recommended preventive care, is never normal and always deserves medical evaluation. A significant and persistent change in bowel habits, such as constipation that is new or worsening, diarrhea that persists beyond what a brief gastrointestinal illness would explain, or a change in the consistency or appearance of stools over a period of weeks, can indicate conditions ranging from dietary issues to inflammatory bowel disease to colorectal cancer and deserves investigation. Bladder changes in older adults are extremely common and are often accepted as an inevitable consequence of aging, but this acceptance can cause people to miss important warning signs. Blood in the urine at any amount is always a medical concern. New urgency or frequency that represents a significant change from previous patterns deserves evaluation, both because it may reflect conditions that can be treated and because urinary symptoms in older adults can sometimes indicate serious underlying disease, including bladder cancer, and in men, prostate conditions that need to be assessed. The embarrassment that many people feel discussing these symptoms with their doctors is understandable, but genuinely costs people their health and sometimes their lives, because conditions caught at early stages when they first announce themselves through changes in bowel and bladder function are significantly more treatable than conditions caught later after they have had time to progress. Beyond these specific warning signs, there are some broader principles about how adults over 60 should relate to their own bodies and their own symptoms that are worth articulating clearly. The first is that the passage of time does not reduce the importance of symptoms. There is a pattern that shows up repeatedly in the research on late diagnosis in older adults, in which people delay seeking care because they have had a symptom for a long time and have rationalized it as part of their normal experience, when in fact it represents a slowly developing condition that was never addressed. A symptom that has been present for months does not become less medically significant because of the time that has passed. It becomes more urgent. The second principle is that the combination of symptoms matters as much as any individual symptom. A symptom that might seem unremarkable in isolation can acquire significance when it occurs alongside other symptoms that together paint a more concerning picture. Fatigue alone might have many explanations. Fatigue accompanied by unexplained weight loss and changes in bowel habits is a combination that demands urgent evaluation. Learning to think about your symptoms in combination rather than in isolation, and communicating that combination clearly to a healthcare provider is an important skill for anyone managing their health after 60. The third principle is that you are the expert on your own baseline, and your healthcare provider is the expert on what deviations from that baseline might mean. The most important thing you can bring to any medical encounter is accurate and detailed information about what is normal for you and precisely what has changed, when it changed, how it has evolved over time, and what makes it better or worse. Healthcare providers can only work with the information they are given, and the better and more precise that information is, the more effectively they can use their expertise to determine what it means and what needs to happen next. The fourth principle, and perhaps the most important one for this particular age group, is that the tendency to minimize symptoms out of fear of what they might mean is one of the most dangerous habits that people over 60 can have. The fear that going to the doctor might result in finding something serious is understandable and deeply human, but it operates on a profoundly backwards logic, because the conditions that are most serious are also the ones for which early detection makes the most difference. Finding a cancer early means treating a cancer that is curable or manageable rather than one that has spread beyond the reach of effective treatment. Finding a heart condition early means managing it before it causes a catastrophic event, rather than after. The information that a medical evaluation provides, however frightening it might feel to seek that information, is always more useful than the absence of information because it opens possibilities for action that remaining in the dark does not. Your body after 60 is not a failing machine moving inevitably toward breakdown. It is a complex and still largely functional system that has been accumulating information and experience for decades and that communicates that accumulated knowledge through the signals it sends about its own state. Learning to receive those signals clearly, to distinguish the normal from the significant, to take the significant ones seriously rather than explaining them away, and to seek the professional evaluation that significant symptoms deserve without the delays that fear and denial create is one of the most important things you can do for the life you have ahead of you. The warning signs that this piece has described are not presented to frighten you. They are presented to equip you, because the person who understands their body's warning system and responds to it appropriately is the person who gives themselves the best possible chance of not just living longer, but living better, with the health and the function and the independence that make the years ahead genuinely worth having.